Ever wondered how nursing in Nepal compares to nursing in the USA? The differences are huge. At least that's what I felt. So let's begin with my introduction. I completed my PCL nursing in Nepal and worked for nearly 3 years in various hospitals. I had the incredible opportunity to serve during the COVID-19 pandemic. After COVID, I moved to the USA as a student, pursued my associate's degree, and while still in school, I passed the NCLEX and started working as an RN in one of the best teaching hospitals in the USA. If you have specific questions about my journey, feel free to comment. I'll try my best to respond. One of the first things that hit me hard was the nurse to patient ratio. In Nepal, one nurse for 10-15 patients. In some hospitals, it's 5-6, but still a high workload. In the USA, 1:5 in MedSurg and 1:1 in ICU, which means better patient care. The workload in Nepal is intense. I remember walking into my shift and making rounds for each and every patient. I had to take vitals, read reports, go through every detail, all on my own. If a doctor arrived, I had to follow them, update them on patient status, and assist in everything. Here's where things get drastically different. In Nepal, nurses handle almost everything, including transporting patients for tests like X-rays. In the USA, nurses focus on critical thinking and patient management, while tasks are delegated to CNAs, certified nursing assistants, and LPNs, licensed practical nurses. I'll never forget my second day of orientation in the USA. A doctor ordered an X-ray for one of my patients. I waited for 45 minutes, wondering when I should take the patient to radiology. Finally, I asked my colleague, and she started laughing. She explained that the X-ray had already been done at the bedside. The lab team had completed it, and the results were already in the system. I was shocked but also incredibly impressed. Technology plays a massive role in the efficiency of healthcare in the USA. In Nepal, most charting is manual, increasing the risk of errors. In the USA, we use advanced electronic medical records, EMR systems like Epic that track everything. Here's a game changer. We scan a patient's wristband and the system instantly pulls up their medication list, dosages, and schedule. The system won't even allow an incorrect medication to be given, drastically reducing errors. It was mind-blowing to me. In Nepal, shifts are usually 6 to 8 hours. In the USA, standard shifts are 12 hours long, though this may vary by facility. It was challenging at first, but I realized that a longer shift means fewer work days per week, allowing for better work-life balance. One of the biggest cultural shocks I faced was the level of autonomy nurses have in the USA. In Nepal, doctors hold ultimate authority, and nurses have limited decision-making power. In the USA, nurses can independently assess, intervene, and advocate for patients. I once had a patient whose vitals were deteriorating. In Nepal, I would have had to wait for a doctor's direct order, but here, I used my clinical judgment, initiated interventions, and only consulted the doctor afterward. That level of trust in my expertise was empowering. While nursing in Nepal taught me resilience, adaptability, and multitasking, nursing in the USA has allowed me to grow professionally with better resources, structured systems, and a strong support network. I love my journey, and I hope this video gives insight into what to expect if you're planning a similar path. If you found this helpful, like, share, and subscribe. And don't forget to comment with your experiences and questions. I'd love to hear from you.